Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Hey everybody, it's Dr. Barry here. Welcome to another episode of the Lunch and Learn with Dr. Barry. I'm on episode 37, and as we do with every episode, if you want the show notes, please go to drpierresblog.com/LLP037. Again, if you want today's show notes, the website is drpierresblog.com/LLP037. Today's a great episode. I think all of my episodes are great, but today's another great episode, and we're going to be talking about 5 chest pains that can kill you, right? 5 types of chest pain that if you get them and you don't get to the hospital quick enough, you will die, right? And again, we don't want to, make these episodes really about life or death, but I got to be honest, with the recent hurricanes, and I'm in South Florida, remember, so for all the recent hurricanes and stuff I'm seeing, I'm having a lot of people walking in with different types of chest pain, chest discomfort for various reasons. The most important thing is that you have people who really don't do nothing for most of the year in terms of any strenuous activity, and then when the hurricane comes around, everyone wants to put up shutters. Everyone wants to, rake the yards and, do all this physical and manual labor, that is very, stressful to the heart, especially a heart that's not working right. So we're going to be talking about 5 different types of chest pains that can kill you. So that if you get some chest pain, some chest discomfort, that you don't just sit home and, try to take an Advil or a Tylenol and try to, just kind of sleep it off. So get ready for another great episode on the Lunch and Learn with Dr. Barry. All right, so it is episode 37, and again, I am ecstatic that you guys have been around this long. For those who've been following me ever since my blogging days, I still blog, but those who've been following me on my blogging days, had to see that we've transformed, and now we're educating and learning through this medium called podcasting is absolutely amazing. So today we're going to be talking about chest pain. In particular, we're going to be talking about 5 types of chest pain, because there's a lot of them, but we're going to be talking about 5 types of chest pain that can land you in the hospital and kill you, right? And I got to be honest, I got to say kill you, right? Because a lot of people don't respond with, 5 types of chest pain, that you should go to the hospital for. No. This is 5 types of chest pain that if you don't get it taken care of, you will die, right? And we got to be as explicit as we can, especially when it comes to our health, right? When it comes to our health, right, we got to put pride to the side, and we got to say, I need to take care of me. I got people that depend on me to do well and be healthy. And we've seen, especially, time and time again, the amount of money you have, the amount of time you work means absolutely nothing if you are not healthy, right? So again, we're talking about 5 types of chest pain today that if you don't take care of it, and I mean take care of it immediately, it will kill you, right? So number 1, right? Number one, go ahead, write this down if you want. First one is the heart attack, right? The one that everyone knows, right? It is the one that you get that crushing, pain that's in your chest, when you tend to ball up your fist. Some people get that feeling where their hands and fingertips are numb. Usually they say it goes to the left side. And usually the reason why I say it goes to the left side is because a lot of the TV says it goes to the left side. But again, there's been studies that show that a lot of the pain tends to go to the right as well. There's really no rhyme or reason why it should automatically go to the left unless you just happen to say it's going to the left, right? So for a lot of people, number 1, a heart attack is the main cause. And when I tell you about the symptoms of a heart attack, it can vary, right? It can vary just depending on your medical history. It can vary depending with your male or your female, depending on your age and what you're doing. But in particular, with this types of pain, especially from the heart attack, you tend to get that gripping, that quote unquote elephant sitting on my chest, that tightness, that pressure, that's just kind of right there that does not seem to go anywhere. And when sometimes some people get like the sweating involved, I get a lot of my patients who come to see me and they say, I just started having this pain, discomfort, while I was like either lying down or while I was maybe doing some work around the house. If you listen to the intro, I talked about how in South Florida, a lot of my patients are getting ready for hurricanes and they're putting up shutters and they're doing all of this strenuous work. That is a lot of work. I gotta be honest, it's a lot of work, but they're not used to it, right? Like majority of the year. Again, if you know South Florida, like I know South Florida in general, but if you know South Florida in particular, a lot of these people don't do no type of work, most of the year, right? Until it comes when the hurricanes and until you got to put that shutters up, until wife is nagging at you that, hey, go put them shutters up and protect my house, right? That's the only time they really start doing strenuous work. And then they start doing that strenuous work. They start climbing up the stairs more. And, they're climbing up ladders, to put the shutters up. And then they get a heart attack. And I was talking to one of my ER docs, and he actually said that the same thing kind of happens a lot up north, especially when it comes with a snowstorm is coming around, right? Once a snowstorm is coming around and, people have to start shoveling snow, you have a lot of people who will end up, dropping dead or, having that chest pain and end up in the hospital as well. Because again, they spend that whole year really not doing anything about, from a physical activity standpoint. And all of a sudden they take their body to the max, right? They take their heart to the max. So chest pain due to heart attack is my number one example of something you got to do to take care of, right? And if you get that chest pain, you get that chest discomfort, and they come to see you in the hospital and they say, hey, yeah, you're having a heart attack. There's lots of different ways to treat. It just kind of depends on what type of heart attack you're having, how severe the heart attack you're having. Again, we can leave that. We can make heart attacks a full episode in and of itself. But, it varies whether it's medications, whether you have to put, what we call cardiac stents in your chest, which is pretty much a stent that's used to keep the vessel open because a part of it is closed. And when you think about heart attacks in the general sense of thing, think about a part of your heart tissue not getting blood flow and causing you that pain, right? Whether it be due to like a plaque buildup or, just because you've been exerting yourself so much that your heart can't keep up with the demand of it. Those are some reasons why you have the heart attack in and of itself. And a lot of times some of our patients will receive what we call a cardiac stent to kind of keep, those blood flow areas open so the heart can get blood flow and not die and not cause you that pain or discomfort, right? So definitely something to think about when we're thinking about chest pain, right? And most people, when they come to the hospital and they're talking about chest pain, that's what they're always concerned about. Like, doc, am I having a heart attack? Dr. Barry, am I having a heart attack? And that's what they always want to, that's the first thing you always want to know. And I can tell you, majority of the time, if you go to the hospital, you say, hey, I think I am having a heart attack, or I'm thinking I'm having chest pain that may be a heart attack. Trust me, you are staying in that hospital because the ER doctor is not going to let you leave, right? Until they know for sure you're not having a heart attack, right? So that's number one, right? And that's one of the most important ones. But again, I talked about 5 different ways, 5 different types of chest pain that can kill you, not just one. Number 2 is a diagnosis or a disease called aortic dissection, right? And what an aortic dissection is actually a vessel, which is a large vessel, that works with the cardiovascular system, that will actually tear open and cause what most patients will describe as this like sharp knife-like pain that's stabbing in the back, right? So again, all chest pains are not the same chest pains, but 5 of these chest pains can kill you, right? So number 2 is aortic dissection, right? For my patients who get this aortic dissections, again, they complain of this shortness of breath. They're tired, they're weak, but they really tend to complain a lot about this knife-like pain. Again, remember, I'm trying to explain it. Knife-like pain that goes to the back, that feels like someone stabbing a knife through their chest that's going towards the back. And for those patients, again, you got to get them in the hospital quickly, right? Because most of those patients will tend to need surgery. That's a big surgery that you need to have done sooner rather than later. And the reason why that's a big thing, because you have this part of the vessel, part of the cardiovascular system that used to be getting blood flow with no problem. All of a sudden you have an area of blood flow that the blood flow is kind of backing up and kind of tearing apart. And I could tell you, for my patients who let this slide, letting an aortic dissection happen, or aortic dissection or a rupture type aneurysm happen, results in about 75% of deaths, right? If you have an aortic dissection, or if you have an aortic aneurysm that tends to burst, 75% of the time you will not make it. So again, remember the symptoms, right? This shortness of breath, this chest pain, this knife-like sensation that feels like it's going towards my back. I unfortunately had one patient when I was a resident, young person, right? And this person was complaining of chest pain, complaining of shortness of breath, but he also talked about how he passed out. That is another concern for patients who are having a dissection, that not only do they have chest pain, chest discomfort, they actually pass out as well, right? So that's something we want to think about when we're thinking about aortic dissection. And I can tell you, in the ER doctors world, in the emergency room, I can tell you on the hospital floor, in my internal medicine world, we are always concerned about something like a dissection happening, right? So that's something we will rule out quickly as possible, right? So that's number 2, right? Number 1, we talked about the heart attack or the acute coronary syndrome. Number 2 is aortic dissection. Number 3 is the pulmonary embolism. This is very popular, I would say, right now. And you probably don't even think about it. You probably have not missed a commercial that have not talked about the treatment. And we're going to talk about the treatment in a second. But a pulmonary embolism is a blood clot in the lung, right? A pulmonary embolism is a blood clot in the lung. And the problem with a pulmonary embolism in the lung is that it causes chest pain, but it also causes shortness of breath. And if it's severe enough, it can cause heart damage as well, depending on how big the pulmonary embolism is. So what's a scenario for a person who may develop a pulmonary embolism? If you've recently had surgery and you are just kind of bedbound for, a week, 2 weeks, 3 weeks, that's a risk factor for having pulmonary embolism. If for my young women who are started on oral contraceptives, aka birth control pills, they are at risk, especially. And I don't know why you would do it. For those who've been following me know I hate this. If you are smoking cigarettes while you are taking birth control pills, you are at risk for having an increased chance of getting a pulmonary embolism, which is a blood clot in the lungs, which causes shortness of breath. And the reason why it causes shortness of breath, if we think about it, I already talked about number 1 being the heart attack, where you have this lack of blood flow in this tissue that dies. Number 3, the pulmonary embolism. When we talk about a blood clot in the lungs, the same premise happens. Blood flow that is supposed to get to a certain area of the lung, which is supposed to carry good oxygenated blood to the lung, does not happen. So that's the problem with a pulmonary embolism, because you start having areas of the lung that don't get enough oxygenated blood to it, and you get short of breath. And then what happens? You get chest pain, you get chest discomfort. And if it's severe enough, you get heart damage, heart failure, and what is the title of this episode? Death. So again, all of these 3 things I just talked about so far will lead to death if you do not take care of it. So pulmonary embolism and the treatment for pulmonary embolism is a lot of these commercials that you see for atrial fibrillation, for patients who are, for people who are, sports fans. You understand that Chris Bosh has suffered from multiple pulmonary embolisms. Why? Because he had a risk that he actually traveled. So again, I talked about that person who's been bedbound after surgery, but let's say you like to travel. Let's say you're a traveler and you actually go out of town and you're on a flight for 3, 4, 5, 6 hours at a time, or you're taking a road trip in the United States and you go from South Florida, Tallahassee, Florida, South Florida, Panama City, Florida, South Florida to Navarre, Florida, Florida, if you do one of those things and you don't get up, you don't move, you have the risk of getting a blood clot in the feet and the lungs as well, right? But in particular, we're talking about the lungs right now. So definitely something you must be mindful of. And when we talk about treatments, a treatment course is actually blood thinners. For those who've been following Chris Bosh, one of the reasons why he had to retire or couldn't play for the Miami Heat was because of the medications that he needed to treat the blood clot in his lungs was a blood thinning medication, which meant that if anything would have happened on the basketball court, whether he got hit in the head, by an elbow, where he fell to the ground and he started bleeding, it'd be extremely difficult to stop the bleeding, right? So that's why they actually had to refrain from him playing basketball, because the medication and the treatment you're on makes that your blood so thin that if you get a cut, you're not just going to stop like normal people, right? You learn very quickly how important and how well the body works. If you're on a blood thinning medication, you get a cut, you keep on bleeding until you put some immense pressure on it. Versus now, if you're not on any of those types of medications, you get a cut. After a couple minutes, your body does that job for it, right? So that's something to think about. Again, we talk about number one, the heart attack, that can kill you. Number two, aortic dissection, that can kill you. Number three, pulmonary embolism, that can kill you. Number four is and we're still in talking about the lung, is called a pneumothorax, right? So number four is a pneumothorax. And what that is and what it causes is shortness of breath. It causes weakness. It causes chest pain. And what happens is that your lung, if for those who want to kind of think about it, your lung actually burst. And part of the way the lung works is that when you take a deep breath in, you take a deep breath out, the air stays in the lung and it doesn't go anywhere else, right? But what tends to happen in patients with the pneumothorax, again, something that can kill you, right? Your lung actually collapses in and of itself, right? It drops. And so you only have, instead of two lungs opening and closing, getting breath in and getting breath out, because of that burst air, it actually shrinks and does not expand. And what we consider a pneumothorax, it actually closes in on itself. And this could be life-threatening, again, because why? Because it's part of the 5 that I talked about. But it's life-threatening because if you're not getting enough oxygen to inside, if you're not being able to take a deep breath in and take a deep breath out, you're going to have some problems, right? Again, your heart's not going to be able to get enough blood. Your lungs are not going to be able to give enough blood. Your oxygen craving muscles are not going to be getting enough blood, right? So it's extremely, extremely, extremely important, right? Especially when we talk about the pneumothorax and, in that sense, from a treatment standpoint, to make sure we're getting it taken care of. Because unlike the other 3 that we talked about, the pneumothorax is actually treated. And for patients who, may experience it or may have a family member who has, you actually have to put a chest tube in the patient's, lung cavity, right, to try to re-expand that lung, right? This is not a laughing matter. This is not something that you're going to be able to kind of sleep it off of. And I've had many patients, whether it be a smoker, whether it be someone who does not have any lung disease, but maybe they're young and they were doing a lot of coughing, and all of a sudden that lung burst and then collapsed on itself. There are different ways to get the pneumothorax, but there's not that many ways to treat it, right? Unless we're talking about surgery and everything else from the sun. And another reason, let's say, again, you're in the wrong place at the wrong time and you get stabbed in the chest, you have the risk. And what usually, causes the demise for people who get stabbed, and particularly in the chest, and not even in the heart, but stabbed particularly in the chest, is because their lungs collapse on them. And that's really the big thing. The lung actually collapses. So you have what used to be the work of 2 lungs is only supplied by the work of one lung, and that one lung can't do it all by itself. It doesn't do a great job, and if you're under stress and anxiety, you're going to make it worse, and then the problems will arise, right? So number 4, the pneumothorax. Again, let's make sure we're caught up on what we need to do. We talked about number 1, we talked about the heart attack, the acute coronary syndrome. Number 2, we talked about aortic dissection. Again, another cause for this chest pain that can and will kill you. Number 3, we talked about the pulmonary embolism. Think about Chris Bosh. Think about the blood clot in the lung that is not letting me get oxygenated blood to the system. Number 4, the pneumothorax. This is the collapsed lung. This is the lung where if someone stabs you in the chest, your lung collapses. This is the lung where if you're a smoker, COPD, asthma, you run the risk of having a quote unquote collapsed lung or pneumothorax. That's the last one. So that's number 4. But last but not least, esophageal rupture, right? And for those who may not be aware from an anatomy standpoint, the esophagus is the tube that when we eat goes from our mouth to our stomach, right? It's a very small, thin tube made of smooth muscle that helps get food from the mouth to the stomach. And I can tell you, I've had a very sad case. I was a resident, I believe. And this patient came in and they were sick and they were coughing, and then they were vomiting. And then all of a sudden they passed out. They got sick. Now, if you're paying attention, you're thinking, wow, is this like that aortic dissection where a person like has some chest pain and, passed out? No, this is different, right? The aortic dissection doesn't matter if you're eating or drinking. That's not going to affect the pain you have. But this is a lady who kept coughing, and then all of a sudden she had this bout of vomit, and then all of a sudden she got extremely sick. What happened when we brought her into the hospital? When we got her into the hospital, what happened? We do our and when I say we, our emergency room medicine folks who do an amazing job. We do our chest x-ray, and we see not only is there air where there's not supposed to be air, but it's also like a piece of broccoli, like where her lungs are supposed to be, right? And that is an extremely, extremely, extremely big problem if you think about it. You hope you're not taking for granted, but you may take for granted when you eat some food, it goes down to the stomach, right? A lot of people may take that for granted, but I take care of a lot of patients who that process does not work. And we almost have to sometimes bypass the mouth and give them nutrition in their stomach, right? That's neither here or there. But when we talk about the esophageal rupture, what happens is because of all of the forceful retching and forceful pressure on the esophagus, or sometimes depending on certain types of food, because of that forceful nature of that results in the patient's esophagus actually rupturing, right? And again, that is extremely, extremely life-threatening. So it's not something that we can even take for granted, because if you don't do anything, the problems will and can arise, right? And that's surgical emergency, right? Like, I don't have to explain to you why it's extremely important to make sure that you go to the hospital immediately because of that. Because if you do not do anything, you will pass away and you will die, right? And I think again, I don't like to be morbid. Again, my goal is to prevent the preventable death, right? And chest pain is one of the big causes of preventable death that if we do something about it, and we do something about it quick enough, we can survive it. But what tends to happen, and a lot of patients in my community, a lot of patients I've taken care of, they're very reluctant to come to the doctor's office, or they're very reluctant to come to the emergency. Imagine if they're reluctant to come to their regular doctor's office, how hard do you think it is for me to get them to come to the hospital, right? So again, and I've been when I made the transition, again, for those who've been following the Lunch Learn when we were just on the video, for those who made a transition, I was big on the outpatient world, and I'm still big on the outpatient world, right? And even with these podcasts, I like to make sure, the topic helps kind of intertwine outpatient, inpatient. But I really felt that I had to do something from a inpatient perspective, because I was seeing so much of it in the hospital. I was seeing so much pain, discomfort, and heart attacks, and all these other different types of chest pain that I was having to treat. So I wanted to make sure, that I got to the bottom of it for everyone, just to make sure we were all clear that this was not something that we can brush off. Right. So let's do a recap again. Today we talked about the 5 common, now I want to say common, but we'll just say 5 top reasons that if you have chest pain, this chest pain can kill you. Right. So 5 reasons. Right. Number 1, if you remember, again, if you're writing, make sure you write this down. Acute coronary syndrome, aka the heart attack. Number 2, an aortic dissection. Number 3, the pulmonary embolism. Number 4, the pneumothorax. And number 5, esophageal rupture. Those are 5. And again, there's a couple more, but I really wanted to focus on, these 5, because I unfortunately saw these 5, I didn't see all 5 of these, thank God. But I saw a majority of them pretty recently. And so I wanted to make sure, especially for those who, we're still bracing for the storm. I think we got like a month or 2 left of hurricane season, right? So we're still bracing for these storms here. So, those who are pretty active, or those who maybe up north and they're pretty active, and winter time's coming, so the snow is about to come, and you haven't done any physical activity, especially your parents and your grandparents and everybody else. Make sure they start doing some physical activity now, so they can get used to it, so something adverse does not happen to them, right? And that is it, right? So I'm going to see you guys next week. Again, if you want the notes for today's episode, please go to drpierresblog.com/LLP037. Again, if you want today's show notes, please go to drpierresblog.com/LLP037. Don't forget to leave me a review on iTunes, a 5-star review, preferably. You guys have a great day. Bye. Thank you for listening to another episode of the Lunch and Learn with Dr. Barry. I want to say thanks again for all that you guys do and all of your support and all of your listens. So I want you to kind of keep on keeping on with going ahead and sharing today's episode. Go ahead and subscribe to the podcast if you're not already subscribed to the podcast. Follow me on Instagram, Twitter, and Facebook, all at the same name, Lunch Learn Pod, and go to the website again, lunchlearnpod.com, for all of the episodes if you've missed one. And again, I'm at all of the favorite podcast apps: Google Play, Stitcher, SoundCloud, and of course Apple Podcasts, where I would love a 5-star review. And tell me what you think about today's episode. I would love to hear it. So I'll see you guys next week. Bye.